Hi, this is Dr. Saxena, and we have been talking about something on this oxygen kind of therapy. How to the focus here is how to reduce the mortality in a COVID-19 hypoxia. My focus will be on this thing called hypoxia. I would like to make you very clear that hypoxia is usually is a cellular response which is secondary to hypoxia, decreased oxidation. So there is in COVID-19, what's happening here is there is a decreased oxygen partial pressure at the cellular level, which is causing the respiratory distress. So you try to understand what happens in the normal patient, and is that you have got a arterial flow which has got high hemoglobin bound oxygen gets into that, and with the venous flow the oxygen is not so there is an efficient kind of supply. Whereas in what happens in a case where you have got unresolved cellular hypoxia, the oxygen is not properly getting bound to hemoglobin, or vice versa. There is a kind of at the entry level of with the lungs, oxygen is not properly getting absorbed into the bloodstream. So subsequently your hemoglobin doesn't have that kind of attached oxygen, and when it goes to the area where it has to dispose of this oxygen, which has to detach this oxygen, that is also not happening. So the areas where this oxygen needs to be, particularly with the RBCs and all that, some of the areas are not receiving oxidation. This results into cellular hypoxia, which leads to something like anaerobic metabolism. You have got cellular organ dysfunction as well as death. So the key thing what is being right now discussed with all the kind of circles is targeted treatments to reduce cellular hypoxia, which is leading to improved survival in COVID-19. All of us are on the same kind of path. Only thing is, what is happening is direct oxygen is a easiest thing to follow that, and people are definitely working on it is see, we need all the things. I'm talking about a scenario where if you can always improve your mechanisms of mitochondria, improve your hemoglobin, and improve your kind of the way hemoglobin dissociates that oxygen from heme. So all these things will help in a tremendous way. But all said and done, when the things that strike suddenly, and you have got a you need to work out on some things, because the mortality of this particular thing is quite high. The mortality in, I can always I don't have to put across this thing, but people are seeing what is the kind of mortality. They are we need to understand what I'm trying to put across is something like hemoglobinopathy in COVID-19. Hemoglobinopathy is something I can always tell you. RBC tries to have this iron molecule, you have got heme in that, and you have got that helical shape and all that. So the COVID-19 is attacking the beta chain of hemoglobin, and with that you whatever ferritin levels what you see, what are the dimer levels are because of that subsequent to that particular thing, because COVID-19 likes that particular beta chain of hemoglobin. So once the beta chain of hemoglobin is attacked by that COVID-19, you have got a dysfunctional oxygenation which probably can't sustain for a long time, and that is one of the things which is resulting into major problems. What can be done for this treating this hemoglobinopathy? What is this hemoglobinopathy, and what I'm talking with this particular stuff? I'm talking about something like hyperbaric oxygen being worked in this for more than a decade with different indications. I believe this is hemoglobinopathy, carboxyhemoglobin, and all these are the indications of hyperbaric oxygen. It's a kind of it comes in the mainstream as well. So this HBOT, this hyperbaric oxygen is US FDA approved for hemoglobinopathy, severe anemias, and carbon monoxide poisoning. So what is happening with the carbon monoxide poisoning and severe anemia and other hemoglobinopathies with the COVID-19 also? The scenario is almost the same. So with this hyperbaric oxygen, we are able to prevent this inflammatory cascade, which is cytokine storm, by restoring oxygen in the cells and prevent that end organ damage. That's kind of thing. So what is this I'm talking about? I'm increasing the oxygen in the plasma by hyperbaric oxygen, something like 2x or 3x under that pressure, and by that I'm that hypoxia is absolutely gone. The thing is, you are trying to increase the because oxygen is under the high pressure. Oxygen is it occupies less volume and it is interspersed into things like anything. And this is one of the things which have been in 2019. We have got papers which are there, which is approved quite whenever there is an exceptional blood loss like anemia. Treatment was hyperbaric oxygen. I was surprised when I was trying to look into the kind of literature, and even if you have got with no blood, if you can sustain with hyperbaric oxygen, because the kind of things dynamics changes with this particular thing. So I'm here to tell that yes, this is hemoglobin value may be decreased in a patient with severe coronavirus disease. Hemoglobin value may not be seen on that particular thing, but I can always tell you this, because of this heme affinity of this virus trying to attack that beta chain of hemoglobin. That hemoglobin is dysfunctional, even if it's quite good, but it's dysfunctional, and that you see kind of so. There is a similarity. There is a similarity between the COVID-19 pulmonary response and the high altitude pulmonary edema. There were a lot of studies which were done in HAPO, with high altitude pulmonary edema, which can be immediately managed just by doing some 2 to 3 dives of hyperbaric oxygen. So there is a similarity between both these things. You have got high pulmonary edema, whereas COVID-19 also you have got increased alveolar ventilation, patient is breathless, heart rate is high, you have got high cardiac. The kind of thing, there is a vascular, see, you have got altered body regulation, whereas with what is being done with some people, particularly we had able to show with kind of 3 to 5 sessions of hyperbaric oxygen with COVID-19 hypoxia, there will be a drop in inflammatory markers, and there is an increased oxygen saturations with hemoglobin saturations. So this is one of the things which I certainly believe can always put that long kind of you need that 3 to 5 sessions, and once you do that 3 to 5 sessions, everything resets, and you don't have to see that you keep on prolonged oxygen till how long you are going to give it. And at the same time, even if you are not getting that particular things, the kind of mortality what we are facing is tremendous. So I'd like to give some of the international references of studies which were done by Spl Hash mostly, and he has done a lot of work on how HBOT increases the oxygen by 160 to 200% in cells. So once this oxygen saturation increases in normoxia, it gets into hypoxia to become normoxia. Things it becomes quite a simple way to get into that thing where all that inflammation, everything subsides just because of this oxygen. And these are the few of the things which I've been working on very diligently, trying to understand that yes, there are some ways how we can always use that oxygen in a proper way, try to work on this particular stuff, and see that This is a for kind of thing, the kind of scenario like this can be definitely a game changer, and it can always help a lot of morbidity and mortality. Not just that, people having that post-COVID myalgias, the people having a lot of headache, confusion, so many problems. Just by putting them, we were able to work it out, and we helped out some fungal problems which were very nasty, and it was basically aftermath of COVID infection. And yes, with this kind of things, we are able to this fungal problems, we are able to solve this with this simple therapy called hyperbaric oxygen therapy. And I am very keen on putting across this modality, and to all the patients, irrespective of what stage they are. I do understand people having a difficult kind of thing, which are into ventilators and all that. It is difficult for them, but if we can pick up some early cases, and we can always storm that ongoing hypoxia, and within, I can always tell you, 3 to 5 sessions it takes, and to make it a kind of thing. And we do some we have done for a lot of cases, we have done 90 minutes protocol, 60 minutes protocol, we have done we have extended to 180 minutes also in one particular day. And this is one thing which is there are a lot of peer-reviewed studies about how hyperbaric oxygen is helping. I would definitely ask you should look into that, because this is not just a simple stuff. It is helping in causing a lot of stuff. You can see, once it has been approved to treat carbon monoxide poisoning and anemia, and this is I think this is a very good deterrent. Hyperbaric oxygen should be used in this present modality. And yes, I do believe hyperbaric oxygen can help in a big way, and it can create that within a day or two, that kind of subtle difference. What patients do, they otherwise they just go on into that hypoxia and go into that vicious cycle, and we can always prevent that ongoing this problem as such. Thank you.